You're listening to In Touch with Terri, brought to you by the Inbound Podcasting Network and Terri Ross Consulting, expert management consulting and sales training to help your aesthetic practice thrive.
When patients come in, it's not about you. It's about them. And they make decisions that aren't necessarily you're going to like or that's convenient for you when they have surgery or what, but realize they're making those decisions for their own reasons, and we need to understand and accommodate that. Best companies, best offices are not ones that sell product or sell a procedure or sell a device. They offer a solution to a problem. So finding out what it is that the problem that the patient has or wants to have improved or a concern to them and answering that, that's the most successful way of having ongoing long-term patients.
Hello, Terri's Tribe. Thanks for joining us for episode 15 of In Touch with Terri, a podcast for healthcare professionals looking to develop systems and processes to attract more clients, convert more patients into paying procedures, and to generate more revenue. I'm Tim Cicciarelli with Inbound Digital Media and the Content Marketing Specialist for Terri Ross Consulting. Okay, listen, the voice that you heard at the top of the show belongs to an industry icon. Few surgeons are as respected by their peers and as esteemed by their patients as Terri Ross's guest today, Dr. Robert Singer. Dr. Singer is a key aesthetic industry opinion leader and a world-renowned plastic surgeon based in La Jolla, California. Terri will run down just a few of Dr. Singer's credentials in just a moment. In this episode, Terri and Dr. Singer will also be covering several valuable topics, including safety in reopening your practice, how practices should inform their patients about how they intend to protect themselves and their teams. What are the appropriate questions to ask when you start accepting patients again? How should practices set up their office with new sanitation protocols? Are there some industry COVID-19 safety standard guidelines to adhere to, and where can you find that information? And finally, how will the COVID-19 pandemic affect the aesthetic industry in consumer spending?
Hello, everybody, and welcome to Tune In with Terri. This is season 2, episode 15. God, I can't even believe that we have gone this far. And really, that is all because of you guys and the listeners, and everybody tuning in and everybody reaching out in terms of how good the content is. And truly, that is the intention behind this podcast, is that we know people have a lot of choices when it's choosing an aesthetic physician. People have choices who they hire as a consultant. And, with my level of experience and the experts I bring on, my intention, again, is to make sure that you have the most accurate information, that you are getting it from the best, and that you can really actually take action with this content. And so today, I am so honored. I actually feel like I have a celebrity. He's a celebrity to me. So tune in till the end and do not leave. He should be a celebrity to you guys. He honestly needs no introduction. But for those of you that don't know him, I have Dr. Robert Singer, key opinion leader, world-renowned plastic surgeon in La Jolla. He has truly been a mentor to me, a friend to me. He has supported me through my years in this industry. I have known him for a little over 13 years. And, despite change in positions or careers, he's just one who I've admired and looked up to. And I think that you will too. So he's been practicing in La Jolla for about 45 years. And if I were to take a minute, his credentials are just astounding. There's really nobody better in the industry to kind of be with me here today, to be with all of you, and to really talk about, let's be honest, to talk about the shit that's happening. Okay, the real world stuff, because now we know some states are coming back, some states are opening. Everyone is concerned about the key word, and that is safety. So, Dr. Singer has been the past president or chair of, literally almost over 9 or 10 societies: American Society of Plastic Surgery, education, patient safety. I could go on, and you could read his credentials on his website. So, I want to start off by welcoming Dr. Robert Singer. Thank you so much for being here with me, Dr. Singer.
Well, it's a pleasure, Terri. One of the things I've always tried to do is help educate the public. That's been the main mission about what's real, what's not, and about safety. And you've done a superb job with that. There are a lot of people out there in the media, they're on social media. Unfortunately, there's no filter, but your listeners have actually found they're a reliable, great source to give straightforward information. And I found you to be that no matter what role you played in the industry.
Thank you so much. Truly, from my heart, that means so much to me. I know we all care about the truth and we all want integrity and we all want to make the best informed decision. So, Dr. Singer, part of what you've sat on in some of your past societies were being the chair of a patient committee on an international level. And I think the key word, and I was so fortunate to be on this webinar that you were on Saturday morning with, some of the esteemed colleagues around the country, Malaysia, Germany. Let's talk about safety, because I know that as people start to open up, everybody is highly concerned about that. How are they going to inform their patients, right? How are they going to protect themselves and their team? So I'd love to hear your thoughts on, what you think of the overall coming back and what this has done to the aesthetic industry, and then how we can protect ourselves from the safety component.
Well, whether it was during COVID, after COVID, or before COVID, safety should always be the key ingredient in any procedure that anybody seeks out, whether it's a non-surgical procedure, but that's still a medical procedure, like fillers or Botox, or whether it's a surgical procedure. That's been the guiding principle of any ethical, well-trained plastic surgeon. And when you mentioned the webinar that you heard, which was from a group of multi-specialty people around the world, but interestingly, Mark Jewell, who is a surgeon in Oregon, and his wife Mary, who runs his practice, and I have been teaching practice management courses for over 25 years at the American Society of Aesthetic Plastic Surgery, which is now called the Aesthetic Society. And we actually put together the idea of having the first webinar for plastic surgeons about safety during the COVID time and how to intelligently reopen the practice, take care of patients, and take care of the staff during that time. So there have been a lot of webinars. I think most of us are webinared out by now. But the Aesthetic Society was really the first to start doing that. And then the other core societies of the dermatologists, oculoplastic and facial plastic, have also followed with that. The important things to realize, there's a lot of confusion right now. And things change from day to day and week to week as new information comes in. And many people who give you predictions of when things will open or things will change or this will be available, that's based on really very poor data. We're getting more data. And if we look at the learning curve about where we are in COVID-19, it's a very steep learning curve, and we're only really at the beginning of that learning curve. So the information that you will hear didactically put out will change in 2-3 days. You have to keep that in mind. The important thing to keep in mind is the fact that you need to go to well-trained, educated physicians for your treatments. Now is not the time to go to a mini mall, strip mall, Medi Spa that used to be a nail salon and is offering treatments and fillers and Botox bars. And actually, there's some vans that come around the house and give you Botox. But you know what? They're interested in themselves. They're not interested in you. And they're not providing the same degree of safety, the same degree of protection, same degree of protective garments and masks and screening that an ethical, well-trained office will do. So now is not the time to rashly do those things. As things open, go to appropriate offices. Have your procedures done by the best trained individuals. I do my own fillers and Botox. And go to places that will say, well, maybe this is not the best time for you to do that, or you're not a good candidate. And I personally say no to patients if they're not appropriate candidates. You have to realize that it's not just going for the consultation. And today, many of our offices, including mine, do virtual consultations. And I think that's going to become more of an ongoing phenomena for medicine. Medicine will change going forward. Those work for some things, but they don't really take the place of an impersonal consultation to feel the tissue, assess if you're a good candidate for different procedures. You also want to think about if you're going to somebody who's aggressively marketing something at this point, is that really in the best interest of you? Is it the best interest of the community? Or is it just really in the best interest of that practice? You need to go to somebody who has a lot of options available. So they can fit you or actually find for you the best procedure rather than fitting you into the technology that they have. And that may be the only technology they have. So everybody is going to get that treatment in their office, although that may not be the best option. When you're thinking about doing things at this point, you need to look at when you go into the office, and actually before you go into the office, have they pre-screened you? Have they asked you questions about your exposure to potential COVID? Do you have symptoms? Have you been tested? Not everybody necessarily should be tested. Ideally, that would be great. I know we will test patients before surgery. We are also going to be doing testing our staff. And this is protection for them as well as the patient. When you go into the office, does it look like the office used to look, or is somebody greeting you? You should be going in wearing your own mask. Are they giving you a hand sanitizer? Is somebody cleaning the doorknobs, all of the things in the office? Are they cleaning the room? Are they cleaning the room after you leave? Do you know if the room has been cleaned? Do they wear protective gear? Have they gone over really a full informed consent about the risks, not only with surgery, but the risks now with COVID, so you understand them? Now, that doesn't mean you shouldn't do some of these procedures in the appropriate facility, let's say an accredited facility. What does that even mean? That means a facility that has a national organization like quadruple ASF that comes in, inspects it if it's a surgical facility, oversees to make sure that it follows all the guidelines for sterility, for staffing, appropriate handling of anesthesia, appropriate anesthesia providers. That gives you the best comfort of knowing that this facility has some oversight. Unfortunately, not all of the states require accreditation of office-based facilities. And there are many individuals who do procedures in their office under maybe just local, which may be fine for some procedures, but they often do that because they don't have any accreditation. No one will give anesthesia in their office. So you have to think about those things. So you want to go to an accredited facility. You want to make sure that you meet not with just the patient coordinator or a marketing salesperson, but you also meet with the individual who's going to be doing your procedures and your surgery. And that's well before surgery, not the morning of surgery. You have to know what's involved as far as post-op visits. How often? Some of those can be done virtually. I think things will change now with COVID, how often you have to come in. And many things can be done, over Zoom or on Skype. But there are times that when you should be seen in the office. And, who's going to bring you in and make sure that that person also has been screened, not necessarily with testing, but make sure that they're not subject to a high risk of having this disease, especially if they're going to be taking care of you after. Let's assume you come in and you've had the consultation, you've had your in-person second consultation, preoperative visit, and then it may be recommended that you have testing. The testing should be done no longer than 72 hours ahead of the surgery. And then let's assume the test is negative. If the test is positive, you shouldn't be having the procedure because the risks go way up. If the test is negative, then you should self-isolate until the time of surgery. All of these things should be really gone over very carefully with you, with the office. The office should be able to fully answer all your questions. If they're unwilling to answer your questions, you're in the wrong office. There are no bad questions. I may have done 1,000 procedures that patient is going to come in for, but they've not had that done. So make sure all of your questions are answered. Most offices today will limit the number of people who come in with you. And in the past, I used to have somebody would come in and they'd have 3 or 4 of their friends, they would have their family. That's not in the best interest now for health. So a significant other can come with you at the consultation, but no more than that. Don't bring in children to the office. And again, if it's going to be the day of surgery, preoperatively and postoperatively, the person who's going to take care of you after should come with you. Those are some of the broad ideas, but we can go much deeper into depth about some of these things as we talk later.
Thank you. No, those were amazing points. And I want to ask a couple of questions. So you gave the tribe some amazing tips from both the patient communication perspective, because one question is, how are we going to inform, right, our patients? You listed a lot of things, right? The pre-screening before they come in, the list of things that have to happen. So that's one thing. The second thing is, you talked a lot about protocols and consents. And, what we don't want is inconsistencies, which we know are going to happen, right? This med spa does it this way. This surgeon does it this way. Is there some sort of cadence, some sort of like industry standard guidelines that everybody could or should follow so that we can adhere, to the principles and the best safety measures of the patient?
It's a great question. And unfortunately, the answer is there is not total consistency, even at the level of the COVID task force from the government or the states or CDC, or if you believe WHO, they're all over the board. There's a lot of consistency in there. The problem on social media is that there's, again, no filter. So people getting a lot of information from individuals who are self-proclaimed experts who have real no knowledge. Unfortunately, there's not consistency between the dermatologists, the derm surgical group, the facial plastic, and the Plastic Surgery Society. Most of the things are fairly consistent. If you're going to have surgery in an office-based facility, and the vast amount of aesthetic surgery is not done in hospitals, it's done in office-based facilities, but again, they should be accredited. I would go to quadruple ASF. They have an excellent guideline and recommendations of what facilities need to do. I would go to the Aesthetic Society. We've had a superbly working task force that's gone over things multiple times, almost every day, to update things for the last 8 weeks. And they've put out guidelines and recommendations for offices. There's a lot of information on that site that can give you clear, factual guidance. So that will help. That'll start. You should also ask the office to send you the information about the protocols in their office. What are they going to do? And that's aside from the informed consents that are specific to any procedure. But we also have, and the task force has come up with, through appropriate input from legislatures and legal counselors, and informed consent specifically about COVID or patients. Not all physicians use that. Not all organizations have that. I know the Aesthetic Society has been a leader in producing that. And similarly, if you're out of the country, and you have listeners from out of the country, the International Society for Aesthetic Plastic Surgery has followed with many of those things and also is an excellent resource.
Okay, perfect. And what I would love, Dr. Singer, is, I want to share these links, right, with the community, with the tribe here, so they have access to that information. That's fantastic. Thank you. Because I think
the link for the Aesthetic Society is surgery.org.
Okay, yes. Wonderful.
And quadruple ASF, you can just look that up. It's 4 A's and SF. They'll have that on their resources as well.
Okay, wonderful. Let's talk about, you've lived through so many other tragedies throughout your life. How do you think, that this pandemic is going to affect the aesthetic industry worldwide? As a consultant, people either are coming to me now more than ever, realizing they have not been running their business in the most efficient way. So they want to, improve their operational efficiencies, understand their finances better, how they can sustain themselves moving forward. And we can talk a little bit about how I help clients do that later. But in terms of people being tone deaf and, bargain-based pricing is not where the industry needs to go. Like, how do you think people can come back, maintain their brand, right? Maintain the quality. Because I know you and I are both in agreement that we don't believe in discounting at all. These are medical procedures. So, share with me your thoughts about the industry as a whole and how you think that's going to affect patient spending or just brand recognition.
Let me address for the practitioners first. Now is the time to look at your practice and have a sensible business plan moving forward. Many of the things that you had, maybe you don't need. Many of the expenses you had within it, you think you need to look at that realistically. You need to look at your personal life and your expenses there and realize you're not going back to what was. It's going to be a different norm. People say, when will it go back to normal? I'm not sure it'll ever go back to what we had before. And that's fine. It's time to reassess. Maybe it's time to reprioritize for you, your family. At the end, it's not how many deals you made. It's not how many procedures you did. Nobody says on their last day, God, I wish I did another facelift. They say, I wish I had spent more time with my family and more time, on holidays and doing those things that were important to continue to learning and making myself and my family better. So I think it's a time to reprioritize for physicians and practitioners. For patients, again, there is going to be, there's a different norm. People may reassess some of the things they were doing, some of the things they thought were important. I think that there are going to be people who are still concerned, as they should be. This virus is not suddenly going away. I think we will see fewer cases. I'm not going to go into all the science of why we're going to see fewer cases or herd immunity or global testing, but we'll see fewer. We'll hopefully see fewer that have significant problems, but that's always going to be there until there's a vaccine. So will hospitals be open to do a lot of these procedures? Right now, hospital census is very low because they haven't been doing elective procedures. So they're thinking how to build up their census, but there's going to be a lot of restrictions about who can do what, when. And if this comes back in another wave, hopefully it won't. And if it does, a smaller wave, you may have shut down for hospitals again of procedures. So office-based surgery can be done very effectively in accredited facilities. There's actually excellent data that shows the complication rate, published data in valid scientific journals that show that the complication rate of infection and other problems in accredited office-based facilities by board-certified individuals with appropriate anesthesia providers, that complication rate is actually less, including infections, than in the hospital. So I think we'll see more and more procedures in appropriate offices. People who are at greater risk, people who are heavy, obese, diabetes, people with hypertension, people with pulmonary disease, people who are smokers and vapors, you need to improve a little bit of your lifestyle if you can and your health generally before you entertain having some of the surgical procedures. The non-surgical, the fillers, the Botox, some of the other procedures may be appropriate, but again, remember that they're still medical procedures. They should be done in the appropriate facility. There's a lot of talk that you're going to see this V-shaped recovery, this sudden interest in all of this pent-up demand of people coming back, and offices are just going to be loaded with patients for procedures. I don't think that's necessarily based in reality. You may see it initially in the first couple weeks for people who were already booked for surgery, and then their surgery was delayed for appropriate reasons, or that the offices weren't open and they want to have some of those procedures. But after that, will you still see that demand? Will that demand be the same? I personally don't think so. That doesn't mean that these procedures are frivolous. They're important to each individual. They may be frivolous to one person, important to another. The best comment I ever heard about aesthetic surgery was by Joan Crone, who was a senior writer for Allure, and she received a journalistic award from the Aesthetic Society. and ASERF, which is the sister organization of the Aesthetic Society, which does aesthetic education and research and has produced a lot of important information about different procedures and will continue to with COVID, with breast implants, with Brazilian butt lifts. She made the comment when she said she got this award and it was about aesthetic surgery, and a couple of her friends said, well, let's face it, this isn't neurosurgery. Well, actually, the training for a good plastic surgeon is as long as that for cardiac surgery or neurosurgery. And secondly, she said, you're wrong. It really is like brain surgery because the biggest difference is not the physical improvement that you get. It's the emotionally how you feel about it. It's the personality change. It's the confidence. It's the comfort. It's all of those things. So the impact is far, far greater than having a little filler or having a wrinkle taken off with Botox. So there are those aspects. So I don't want to say that this should be looked at as, why would anybody do this at this point? When it's very rewarding to have somebody come back 30 years after and say, you did my nose when I was 19 years old. It was the best thing I did for myself. It gave me confidence. It made me comfortable to pursue things, to do things in education and business that I felt uncomfortable doing. That's what makes it all worthwhile for us who do that. So it has a lot of things beyond just, getting rid of a wrinkle.
Dr. Singer, thank you for that information. Astounding and always, always invaluable. So many key takeaways that I want the tribe to really go back and evaluate where you are in your practice. Again, the accreditation, the safety measures you're taking with communication, how you're, looking at your consents and your protocols. We'll provide those links. But, one thing that you just said, which I think really needs to hit home for everybody, is that we can't assume that our doors are going to be flooded with patients. That would be fantastic. But we know that, people are going to be hit financially. They have been hit financially. But what I love that you just said, which is exactly what I teach, and perhaps this is because I've had formal training my whole life, but you said that it's not just about the beauty on the external. It's about the internal and the way somebody feels. And, when I teach my sales training course, I think people that are in these aesthetic positions, whether you are a front desk, and I don't even like that, you're a front desk concierge, you're an extender, you're a doctor, we are not selling you guys. We're not selling breast dogs. We're not selling cool sculpting. I'm not selling the filler. I'm selling the emotional aspects of how that makes me feel. And I always use the analogy. And so I think what Dr. Singer just said, if somebody just had a baby and now we're at home, our exercise habits aren't the same, our eating's not the same. And if somebody had a baby a couple months ago and they're just feeling not so great about themselves, like when we're able to return and get a procedure, it's about the emotional, right? It's about maybe going on that vacation, feeling better in that body. So thank you for sharing that component of it. What do you think is going to happen knowing that people are going to be very cost conscious, as they should be, with people just, slashing prices and or discounting just to get people in the door?
First of all, full disclosure, although I've known Terri for many years and I've respected her, I have no business relationship with Terri. So you should know that. The other aspect of that is that I've reviewed her materials and her teaching courses. And I know of a number of good consultants in the industry. I've never seen better information that's practical, sensible, and honest than what I've seen that you've produced and that what you teach. Because first of all, you've had a lot of experience. But secondly, your information is sensible. It's common sense. Unfortunately, common sense isn't common. And it works on the basis, which I've always believed, is that people don't like to be sold something. They like a menu of options and they like to purchase. They like to be in command. They don't like to be talked down to. They don't want somebody authoritarian telling what they need to do. And you've been very good about, in your teaching courses, laying that out. And I think every office needs to think about that. How do you communicate with these individuals? Each individual is different and they need a different way that you communicate with them. You can't have one approach that fits everyone. Different personalities need different approaches. As far as cost, savings, nobody likes to waste money, but generally in life, you get what you pay for. And save on bargains for t-shirts and sandals. Don't do it on your face. Don't do it on your body. You have to live with those forever. Remember, there's no eraser at the end of a scalpel. And there will be a lot of individuals, and there are going to be a wealth of strip mall spas that are going to offer all sorts of bargain deals. First of all, you don't know what you're getting. You don't know if it's authentic product, if it's come in from God knows where and is counterfeit. You don't know if it's been diluted. You don't know necessarily who's doing it for you. Every practice is different. Everybody has a little different approach. The top surgeons in New York that I know, or in Miami, or in Dallas, or in La Jolla, are all going to practice differently. We have different personalities. We have different approaches. I don't think you want to race to the bottom of competing at the lowest price, because you can never recover from that. People will always want that bargain. If you want to discount, that's up to you. I don't believe in discounting. What I would rather do is have a value-added benefit. So if somebody's coming in, and normally I wouldn't be giving them skincare or Botox if they're going to have a facelift or have something else or their eyes, I may include that. That way, the price is still the same. I don't feel that I've compromised myself, but I've given them something extra. So they're still saving money in the end on that. But every situation is different. I will look at certain patients who have a particular financial situation or home situation, who may want to do something. And I may say, you've been a good patient here. I've operated on you several times. I may charge you a little bit less for this or provide something else with it. Or maybe rather than jumping into doing everything now because of the increased time, the increased risks, and doing longer procedures today with COVID and patient protective equipment, it's going to cost surgeons and offices much more to do those procedures than it was in the past. So you have to take that in consideration. And I may tell somebody, maybe it's better off, rather than doing that combination procedure that was going to be lengthier, that had some greater risks. Let's think about splitting that up. Let's think about doing things sequentially. There are some procedures that I would do, the combination. I don't just do facial surgery, a combination of body contouring plus, where I may have thought about admitting that patient electively to the hospital after. I'm on the grounds of Scripps Memorial Hospital in La Jolla. We have an excellent arrangement to be able to admit patients post-operatively that we do electively in the office. But if it's a lengthy procedure and I normally would have admitted them after, I'm thinking now's not the time to do that. Rather, split up the procedure where you diminish the risk of having to go in the hospital after. But realize any procedure may have potential complications. Anybody who tells you they've done this, they've never seen a problem, either they've never done the procedure or they're lying to you. You need full informed consent to know what you're getting into, but realize that the vast majority of procedures in appropriately trained hands have minimal complications. And if you look at the statistical rate of patients who've had cosmetic procedures, how many would do it again? The vast majority, in the 90%, are happy they had it, didn't have problems. But if you have a problem, even though statistical rate is 1%, if you've had it, it's 100% for you. So you have to put all those things in perspective, but you need to put all of those things and balance them when you make a decision. Everything in life has trade-offs.
Thank you first and foremost for, again, your always ongoing support. And, just to recap kind of what Dr. Singer said, we are friends. God, he's like family to me. He supported me. We have no ties, no relationship, but he knows how important the information and the training and the consulting that I put out, I want it to be the best. I don't want to be half-ass. Everything I do is really for the best outcome of my clients. So thank you for your support. with all my material. I want to kind of recap too on what Dr. Singer said. This is not the time to be discounting, not just because we want to get more patients, but Dr. Singer also kind of reiterated exactly what I teach. The importance is that we want patients to have the wow factor, right? We want them to have the best outcome and the best results. And the only way to get that is by doing two things, making sure you are educating. I always use the words, we are in a retail business, so we're selling, but at the end of the day, that's your obligation, is to educate your clients. Because if you don't, I'm going to go someplace else. I'm going to come to you for Botox. I'm going to go to you for my boob job. I'm going to go to you for my facial. Come to my one office and build me the treatment plan. And as Dr. Singer said, add in the value, add in some things that could be a benefit to whatever procedure they're getting. And then I think the last thing that he pointed out that I want you guys to realize, if you're considering discounting, is that when you're doing a procedure, whether it's a surgical procedure or it's an Ulthera, you're having to wear these N95 masks or whatever mask you have. They're not that comfortable, which, to his point, the procedure, the surgery, it is going to take you probably twice as long to do it. So now if you're cutting down the price, you're not seeing as many patients because you're in the OR twice as long. You really have got to understand your business model, which comes back to, during these last couple of months, I want to really ask you, be honest. What steps have you taken to understand your P&L, to look at your balance sheet, to cut your debt, to do a practice assessment in deep? And if you haven't, that's cool. And I would love if you want to call me to talk about how I can help you. But to his point, we're not going to go back and do business as usual. One last question. Well, actually two. I always say inspect what you expect. You and I have been talking the last couple of months on the ASERF and on the AN data. And we all know, God love everybody out there, whether you're a physician, a business owner, most people, practice manager, you guys have a difficult time understanding the data, understanding how to read it, how to pull it out of your patient management software. What KPIs do I look at? What the hell even is a KPI? Why does it even matter? Well, it matters. And so we've been discussing the AN data that's been a part of the Plastic Surgery Society. But now more than ever, I'd love for you to tell the tribe what is in the AN data. And then number two, how we can take information to make better decisions.
So ANN is Aesthetic Neural Network, and it was developed by the Aesthetic Society in cooperation with Anzu Medical. It seamlessly extracts data from, it doesn't have to be an EMR or a practice management system. So there's no effort on behalf of your staff. It does this on an ongoing daily basis. It extracts the data. So it can tell you the number of cases, the number of people who come in for consults who scheduled. It can tell you the people who come in originally for Botox, how that ultimately has value down the road. How much does that lead to additional surgery? What other procedures do they do? What's your most effective of your neurotoxins, a simile of your fillers? It gives you data that we've never had before in a simple manner. Now, data is great. How you interpret it and what you do with it is another thing. So you need to have some guidance as far as there are tutorials of how to look at your KPIs, how are they meaningful when you're looking at modifying your business plan. It gives you tremendous information. Older surgeons who are thinking about selling their practice, it's invaluable, the KPIs beyond your P&L sheets. ANN is available for those members of the Aesthetic Society. There may be ability in the future for other plastic surgeons and other societies, non-plastic surgery core groups, to have something similar through ANZU and ANN. There are other things that ANZU is doing that are invaluable. They're developing with the Aesthetic Society a breast implant app. So you can store all your data. You have all of that where people, they come in and they say, I had implants 20 years ago. I don't remember my surgeon's name, or he's not in practice and I have no idea what kind of implants. Here you can store that. You have that ongoing. You have communication with the doctor's office. You have a lot of Q&As. So there are a lot of things that this is invaluable for. I would urge any plastic surgeon who's listening to this, who's not a member, who's eligible to be in the Aesthetic Society, to apply for membership because this alone has tremendous value added benefit for your practice. Before I leave, I want to point out just a couple things. When patients come in, it's not about you. It's about them. And they make decisions that aren't necessarily you're going to like or that's convenient for you when they have surgery or what, but realize they're making those decisions for their own reasons, and we need to understand and accommodate that. Best companies, best offices are not ones that sell product or sell a procedure or sell a device. They offer a solution to a problem. So finding out what it is that the problem that the patient has or wants to have improved or a concern to them and answering that, that's the most successful way of having ongoing long-term patients. And it's not about treating them once. You want them coming back for other things other than what they initially came in for.
Thank you. Thank you. Okay, my one last question, and then we will wrap it up because this has been extremely invaluable for me too. There's a lot of things going around that I'm seeing as well, and I'm getting, texts and emails about, Terri, what do you think about this UV lamp? And what do you think about this sterilization thing for my practice? What are your thoughts about these pieces of equipment now that are being sold that say, hey, you can roll this into your office, your room, and it's going to sterilize at 99.9%. Is this legit? Is it a fad?
I think that most of those things are promoted by the manufacturers with very little data. And until there is good scientific, valid, published data that an organization like CDC or American College of Surgeons looks at and says, yeah, that works, that's okay, I would be very wary of some of those things. Now, I think you want to take all the appropriate precautions that you can to make the office as safe as possible. But you also want to look at your bottom line and say, is now the time? And industry has been great in this arena. They've been superb supporting education during this, but is now might not be the best time to expend a lot of money for capital expenditure for new equipment until you know it's really going to have a place, we're going to make a difference, or if it's something that's being promoted for a procedure, that it's going to be cost effective, that it's going to have a reasonable lifetime of use, that you have enough patients to support it, that you're not going to be crippled by warranties that aren't there, all of those things. I would say now is the time that you need to be cost conscious about what you bring in and what you expend, because as we said before, you're not going to suddenly day two go back to what it was before, and you need to think about making plans. I've chosen to keep my staff all during this and pay them, although nothing was coming in. Different offices will have different approaches. I don't have 50 and 70 employees. The offices that do have to think about things differently. But you need to think about not only what comes in, but your expenses going out. That ultimately is reflected on your bottom line. And you can only survive putting a lot of money out and not bring it in for so long.
Dr. Singer, thank you so much. Right, always from the bottom of my heart, I'm so honored and blessed and fortunate to have you in my life, again, as a friend, industry colleague, somebody who has just been there, again, as a long-term mentor for me. I hope that, Tribe, you took away a lot of key, really critical, really vital things from, again, a world-renowned key opinion leader in the industry. It really just does not get better than this. So, we talked a little bit about evaluating your practice, why it's important, what decisions you can make, because now is the time. And if you're interested in that, please go to terrirossconsulting.com/PA. We will make sure that we provide the links to the society so that you can get the list of information. And Dr. Singer, any last words before we wrap it up?
Take care of your family, stay healthy. That's the key thing. The interest in aesthetic procedures isn't going to go away. You just want to make sure you're healthy enough and your office is stable enough to provide those when patients want them. I want to compliment you for your professional ability to educate, and not only the public, but those who provide the treatments. I think it's invaluable, and you do it in a very straightforward, honest manner, which is refreshing to see.
Thank you so much. Thank you. Thank you. Will you guys please tune in? Again, I want to welcome and thank you, Dr. Singer, so much for your time today and for just, allowing me the opportunity to do what I do and to provide the industry with the best information, with the best, which are people like you. So thank you so much, guys. Tribe, keep listening, stay healthy and safe, as he said, and I look forward to the next episode. Take care. Bye.
What an honor to have world-renowned plastic surgeon and key aesthetic industry opinion leader, Dr. Robert Singer, with us here on In Touch with Terri. Dr. Singer mentioned several resources in the midst of this episode, and we have links to all of them available in the episode notes. Now, if you haven't already, after or while you're listening to each episode, we hope that you're diving into all the episode notes to access the resources mentioned in this and every episode of the podcast. They're really easy to find. Just scroll down in whichever podcast app you're listening through, whether it be on your phone or on your computer, and you'll find them right there waiting for you. Another one of those links will be to Terri Ross's online video course. It's titled, Practice Foundational Elements, Your Roadmap to a 7-Figure Medical Practice. This downtime is the perfect time to drill down into this practice-transforming content. Doctors Nicole Bassa and Alan Abondo and their staff at Cedar Park Aesthetics did just that. They took advantage of this shutdown and loved Terri's course so much that they were kind enough to film a quick testimonial about it, which can be found on Terri Ross's YouTube channel. See the video for yourself by clicking on the YouTube link in the episode notes. Now, right near that link will be yet another link to learn more about how to sign up for Terri's online video course. This course is going to help your practice come out of this shutdown even stronger than before. You will be armed with the same strategies that helped Terri herself scale her Beverly Hills Medical Spa, yielding growth of $600,000 in just 1 year. Well, my company, Inbound Films, had the pleasure of filming the video for Terri's online video course. We manage all of Terri Ross's marketing videos for Terri Ross Consulting, and we filmed all of the videos for Terri's Beverly Hills Medical Spa. Well, we would love an opportunity to help you achieve the same success Terri has had with video marketing. I offer free video conferencing consultations via Zoom, and if we find out that we're a fit in the midst of our meeting, then we can use this downtime to begin our strategic pre-production process so that we can be ready to film as soon as it is responsible to do so. So again, see all of the links in the episode notes to sign up for Terri's course, learn more about her through her YouTube channel, and for a way to contact me. I'd love to chat with you. Finally, please don't forget to hit that subscribe button to In Touch with Terri. That way you won't miss a single episode. For Terri Ross of Terri Ross Consulting, I'm Tim Cicciarelli with Inbound Films and the Inbound Podcasting Network.